Hello, and welcome to the second part of the discourse on designing the evaluation. In this lecture, we'll look at the process of determining the evaluation questions and the evaluation design. So, at the end of this lecture, you should be able to describe how to choose a process or outcome evaluation question, and describe evaluation research designs, list and describe the threats to internal and external validity. So in addition to describing the program, stakeholders identify the evaluation questions in the first step of the participatory model, that is designing the evaluation. So evaluation questions guide the evaluation team in conducting the research to fulfill the primary purpose of an evaluation, which is to gain insights into the initiative and how it is implemented or to assess its effects. The evaluation question drives the research design and the data collection methods. Without an evaluation question, there really is no evaluation. So evaluation questions must be clear and specify what is being assessed and be linked directly to the program or policy being implemented and be linked to indicators that allow for direct or indirect measurement. And they must also incorporate the needs and expectations of stakeholders. The logic model may be used as the starting point for identifying evaluation questions, as illustrated in this figure. So they've assembled the evaluation team and other stakeholders make their way across the logic model from left to right. At each stage, the question is asked, what do we want to know? For example, in the resources box, the question might be what resources are provided for the initiative or a part of the initiative. In the outputs box, the question might be how satisfied are our clients or how many and which clients did we serve. However, stakeholders may want to assess the effects of the program on the participants. And they may have questions such as what changes occurred in the participants, or were participants in the initiative more successful than those who did not participate, or what effect did the enactment of the policy have on underage drinking. The evaluation research questions are based on the concerns and priorities of the stakeholders and the components of the logic model, the initiatives previously developed outcome and activity objectives, and the expertise of the evaluation team. So, with regards to concerns and priorities of the stakeholders' expectations of the program may be different from the stated objectives. In in one evaluation, the following questions were identified by a stakeholder. Are customers purchasing fruits and vegetables more frequently following the intervention at the store or in total? Which food items are selling the most? Has the store profited from the sales of fresh produce? So these questions led to considering a number of factors about the evaluation and the stage of the initiative, the evaluation design, and the data collection methods. The components of the logic model may help frame evaluation questions too. And the logic model is an excellent tool for thinking through the most appropriate elements to measure. So each box in the logic model provides opportunities for evaluation. Evaluation questions related to inputs allow the evaluation team to assess what resources went into the program, and as well as what resources were expended as a result of the program. This is valuable information in the conduct of a cost benefit analysis or for the purposes of accounting or replication. Outputs are also useful. to determine. They provide first indications that the program is working. If, for example, the goal of the program is to reduce the incidence of obesity among children, one of the outcomes or the outcome objectives would be to increase access to fresh fruits and vegetables. One of the activities would then be to organize farmers markets. The theory of action of the initiative suggests that farmers markets, once accessible, will provide fresh fruits and vegetables. By consuming these products, children will lose weight. So a measure that would indicate that the program is working would be the number of farmers markets that spring up within a specified time frame. And these are outputs, and these outputs correspond to the activity objectives. An output for this hypothetical program could then be that there should be 10 farmers markets with 18 farmers each in the first 6 months of the program. Outputs provide the numbers produced and not the outcome or impact of the activity. Outputs do not tell us the effect of the program on childhood obesity, for example. However, in this hypothetical program, the fact that 10 new farmers markets have been created indicates that a program component is working. Stakeholders may be interested in many of the outputs from their programs. Outputs are the most often assessed results of a program's implementation in the early stages before outcomes and effects of the program can be measured. Assessing outputs is a means of determining whether the program is being implemented as planned. And the initiative's short, medium, and long-term effects, and that is the outcomes and the impact, form another critical component of the evaluation. Outcome and impact questions are concerned not with whether the program is working, but with whether it's made a difference. In the next slide, we'll look at some questions that can appropriately be asked with regards to each logic model component. Another basis for selecting questions is the program's objectives. The objectives adopted during the development phase define the activities of the initiative and the expected outcomes, and are the basis for developing the evaluation plan and assessing the implementation and effectiveness of a mature program. The evaluation may assess activity objectives such as volunteers from the regime will provide information on outreach activities in the community surrounding the regime for 60 days before the start of a cycling intervention to raise awareness of the importance of exercise for cardiac health. Alternatively, it may decide to assess outcomes such as by the end of 3 month intervention, 50% of the participants in the regime cycling intervention will report cycling at least 30 minutes per day. As has been stated before, to avoid mixing things up for your assignments in this class requiring you to provide objectives, please stick to just activity objectives. In addition to objectives that serve as benchmarks for the program, stakeholders may identify principles against which the initiative can be appraised. These principles may include social justice and the equitable and ethical distribution of benefits and goods and services. So another consideration in selecting questions for the evaluation is the expertise of the evaluators. Evaluators with a high level of expertise and experience may provide additional insights into the program that lead to added ways of thinking about the evaluation. The expertise of the evaluator and the evaluation team determine the most appropriate evaluation design for conducting the study. So this table presents some questions that can appropriately be asked with regard to each logic model component. So for the resources and inputs component, you can have a question like what funding, personnel, space, or materials were provided for the initiative. Under the activities, you could ask what training activities were carried out and what advocacy activities were done with legislators to promote a new legislation. Was initiative carried out as specified in the protocol? And who is or is not participating in the initiative? How culturally appropriate is the initiative? And for outputs, we could have questions such as how many individuals participated? Were participants satisfied? How many brochures were distributed? How many activities were carried out? How many people were trained? And did coalitions form? And for the outcomes, we could ask what changes in knowledge, attitude, skill, or behavior occurred in the participants. Were participants more or less successful than those who did not participate? And then for the impacts, we could ask, was there a change in the prevalence of obesity among children and adolescents? What effect did the enactment of the policy have on underage drinking? So the evaluation team must select the research questions that best provide information for decision making and that improve evaluation knowledge and practice. There are many approaches for identifying the research question. One uses a participatory group process and a 2 by 2 table. So one participatory group process is the nominal group technique. A suggested modified nominal group process is what we're going to describe here. So in that process, each member of the stakeholder group makes a list of evaluation questions that he or she would like answered. Then the facilitator asks members of the group in turn to provide one question each to a master list on a flip chart or a board that is visible to the whole group. As an evaluation question is added, a show of hands provides a count of how many people included a similar question in their lists. And this number is recorded next to the question on the flip chart. The questions on the participants' lists are cancelled as they are accounted for on the master list. The process continues until all members have contributed all the items on their list that are different from previous questions, and all the questions have been crossed off in their list. The facilitator then reviews the master list with the group, and with the consensus of the group, eliminates or merges questions that appear similar and that ask fundamentally the same question. The final list sets the stage for deciding on the final set of questions. A traditional 2 by 2 table can be used to sort the questions and identify priorities. If the evaluation is to be useful and the results utilized, questions that are of primary importance to the persons requesting the evaluation or to other stakeholders must be answered. So as shown in this figure on display here, each evaluation question is reviewed and placed in the appropriate box. If the evaluation team considers that the question will have a high impact in its ability to contribute to the decision-making process and to improve evaluation knowledge, and the question is put into the quadrant labeled best choice. Another question that might have a high impact in contributing to decision-making but does not improve the evaluation knowledge overall goes in the good choice box. This process continues until all the questions are placed. Once this process is complete, the questions in the best choice and good choice quadrants are the most valuable because evaluation is primarily about the initiative being assessed, and evaluation must contribute to decision making. So research-oriented evaluations may want to answer questions in the OK choice quadrant, and questions that fall into the poor choice quadrants may not warrant time or resources, as they neither improve knowledge overall or contribute to decision making. So in the previous lecture, we have talked about the pre-program evaluation, which is part of the formative evaluation that is developmental in nature and answers questions about whether the program should be implemented as designed or modified to perform better or cancelled entirely. And here we are concerned about other aspects of evaluation that can be done during the program or after the program implementation. Once the process of selecting evaluation questions is complete, a review of the question that meets the criteria for the evaluation will determine the focus of the evaluation. If the selection process led to questions that were focused primarily on understanding the implementation of the program or policy initiative, then a process evaluation is the appropriate approach. And if the selection process led to the identification of questions about the effectiveness of a program that is already stable, then an outcome or impact evaluation is appropriate. In process evaluation, the focus is on the implementation of the initiative at any stage of the program. And a process evaluation focuses on the hows and the whys of a program and gets at the question and what works. It may also be focused and it may also be used to get at the question, how can the program improve and what it does? And it is then more appropriately called a formative evaluation. So a well-conducted process evaluation precedes an outcome evaluation. Determining the level and scope of the initiative's implementation will provide information with regard to why the program is effective and provide the context for an outcome evaluation. An outcome evaluation assesses the effectiveness of the fully implemented and stabilized initiative and measures the extent to which the initiative made a difference to those who were exposed to it. It addresses concerns that were identified in the needs assessment. An outcome evaluation may ask questions such as, did participants in the program increase their knowledge, self-care, or utilization of services? Did the community improve access to services? And did the organizations provide needed services for their patients? It could ask questions such as, did the public policies instituted to reduce the risk of disease, disability, or death make a difference? And did the program have the effect in reducing greenhouse gases? The evaluation may also ask what were the costs and benefits associated with conducting the intervention, and was the outcome of the program worth the investment? Yet another approach is to conduct an impact evaluation in order to assess broad changes in quality of life that occur at the local, state, and national levels. An impact evaluation focuses on determining the overall change or effect of the program. It is usually further out in time and evaluates change in the baseline and targeted health or system status. So an impact evaluation may ask questions such as, did the programs that were instituted in this community make a difference in the incidence, prevalence, or rates of disease? And did the quality of life of the residents improve? So we will focus primarily on process and outcome evaluation in this lecture. So we'll start with process evaluation. Process evaluation is an ongoing check of the implementation of an initiative. It provides information on the extent to which the program is being implemented as planned. It may assess the context and the reach and the dosage or intensity of the initiative and the fidelity with which it is delivered. Process evaluation assesses the initiative at the level of resources or inputs and outputs and determines the effectiveness of the administrative functions of the program. It provides information that is used to improve intervention activities and operations. It documents whether the initiative is meeting participants' needs. It identifies any barriers to program implementation, and it looks at participation levels and satisfaction. It asks these questions such as, is the program or intervention being implemented according to the plan that was laid out before the program started? And what type, quantity, and quality of services are being provided and to whom? What are the products of the program's implementation? And so fundamentally, process evaluation assesses what works and establishes initiatives' ability or inability to achieve its outcome objectives. It monitors whether the intervention is being delivered with fidelity, determining what works for changing policy in a community through an initiative of a statewide community-based organization may lead to a list of questions such as who are the participants in advocating for, developing, and changing the policy, and what human, financial, and material resources were provided and used, what educational and advocacy activities were carried out, were all the components of the plan implemented, if not, why, uh, who or what was the level of implementation of the initiative, um, how extensive was the intervention, what methods were used to recruit participants, and when and how many were used, what coalitions were formed, and what materials were developed, what training was provided or received, are the resources provided for this program adequate, are the data collection tools appropriate for assessing program outcomes, do preliminary findings indicate that the intervention is likely to produce the anticipated outcomes. And so answering a process question requires the evaluation team to determine whether the initiative is being implemented according to plan and whether the intended individuals are participating. And considerations in whether to conduct process research or process evaluation include the feasibility of the evaluation based on the available resources, the budget, expertise, and experience of the evaluation team, the time available for the evaluation process, access to and availability of administrative and participant data, availability of other data, and ability to collect them. So another consideration in process evaluation is determining the resources, the processes, and the outputs. A process evaluation generally measures resources, activities, and outputs as they pertain to the implementation of the initiative. Um, Assessing the resources, in answering the question, what human, financial, and material resources were provided and used by the initiative, the components that are assessed will include funding levels and distribution of financing, resources available and utilized for developing the initiative, number and qualifications of staff and others implementing the program, the quality of the curriculum used for training those delivering the program and for program participants. With regards to assessing the processes, in answering the questions, was the initiative implemented as described in the plan? And how well was the program implemented? The components that are assessed will include the implementation of components of the initiative, intensity and reach of the activities, participation of target population, staffing for program activities, and also the training. In terms of assessing the outputs, outputs are the specific products that result from the initiative. Components for assessing the outputs of a program will include materials developed, the services provided, the people trained, and the plans put into operation. So the outputs of the initiative are the products of the initiative, like I've said. So to assess the products, we have to know what the initiative was intended to produce. And we get this information from the description of the program and from a well-developed and complete logic model. Another source is the activity objectives. For example, if an objective is by January 2026, organize two well supervised rock climbing trainings for 30 youths aged 19 to 24. The activity is the training, and the products are two training sessions and 30 trained youths. Information on outputs may also be contained in other project documents. So once we know what was expected from the project documents or from our knowledge of the program, the next task is to determine whether the outputs exist. In the rock climbing hypothetical exam program, the specific outputs would be the number, gender, race, or ethnicity of the trained youths, the level of participation in the training, the satisfaction of the youths with the training program, um, unanticipated outputs from the training that may have been observed, and the type and level of supervision. We also look at indicators respect to process evaluation. Indicators are the quantitative or qualitative variables that allow the changes that occur as a result of an intervention to be measured. So indicators show whether the intended results are achieved. They are objectively verifiable and can be assessed repeatedly. Two indicators that the rock climbing training was carried out is the number of sessions and the number of participants, and the instrument for measuring these, that is the data source, and will be or could be the sign-in sheet, and which would have the signature of each person who attended, or each person may be required to complete a satisfaction survey and to assess indicators of attendance and level of satisfaction. Quantitative indicators measure changes in numerical values, and qualitative indicators measure changes that are less well defined but that are agreed to by the stakeholders as measures of success. Indicators are the standards against which performance of the initiative is measured. Because a large part of the responsibility in process evaluation is process monitoring and documenting the initiative's day-to-day activities and expenditures in a consistent manner, data may be collected by visiting and observing activities and reviewing documents like work plans and minutes from meetings. Indicators that the event occurred could be assessed using logs, surveys, individual interviews, and focus groups. And discussions with program staff and beneficiaries could be used to complement these. Numerical indicators that show a change has occurred can be plotted in a bar graph, as in this figure, and which shows performance of the indicator following the intervention. So outcome evaluations ask, did the initiative make a difference to those who were exposed to it? They assess the expected effects as well as the unexpected effects of the program. They assess whether there was a change in the indicators and determine whether the change was caused by the program. And unlike a process evaluation which is carried out throughout the program, outcome evaluations are carried out after the program is stable and the initiative is expected to have had an effect that is measurable. Carrying out an effective outcome evaluation requires that baseline data be collected for each participant and each indicator. Baseline data are collected prior to implementing the initiative. As in conducting a process evaluation, carrying out an outcome evaluation requires knowledge of how to reach the population and the resources for carrying out the evaluation, the expertise available, and the timeline. Outcome evaluation questions may include: did participants' level of knowledge or awareness change with regard to the program focus? And what percentage of participants increased their use of a product for the prevention of a disease or disability? And what percentage of participants reduced their exposure to disease or disability? Did the reduction of pollutants in the air reduce the rates of asthma among children 1 to 5 years old? And did the policy that was aimed at reducing the incidence of violence in a local community have any effect on violence among youth 18 to 25 years old? Did an intervention to reduce attacks on the elderly result in fewer seniors with life-threatening injuries over a 12-month period? And what were the costs of the initiative relative to the benefits? So as we have described previously, a 2x2 table may be used to identify the questions that are important for the evaluation. Outcome evaluation often uses surveys, individual interviews, focus groups, and observations to assess concepts and constructs that can be difficult to measure. And the process of specifying the indicator for measurement involves putting the concepts fully into operation and then deciding on the best means for determining their existence within the sample being studied. So either qualitative or quantitative data collection approaches can be used. Such measurement requires the specification of one or a number of indicators of the presence or absence of the phenomenon. For example, access to care could be measured at one or more domains. At the individual level, will assess knowledge, attitude, and practices. At the interpersonal level, it could be peer or family influences. At the community level, we could be looking at jobs and transportation and their influence on utilization. At the organizational level, we could assess organizational norms, practices, and services that influence an individual's ability to access services within the institution. And at the public policy level, we'll be interested in laws and policies that influence utilization of services by members of the community. And so the approach that is adopted in the measurement of access to healthcare allows for different conclusions to be drawn. And incorporating more than one domain allows for a comprehensive view of issues and the root causes that affect access. So measuring access only at the individual level leads to a more restricted view, and hence then there are fewer indicators to measure. So once the measure has been fully conceptualized and the indicator has been specified, decisions can be made about the approach to measurement. And the conceptualization of a measurement and the choice of an indicator may differ from one researcher to another and are often influenced by the researcher's discipline and the available knowledge about the concept. The team of evaluators discusses measurement issues for the evaluation and relies on both their expertise and existing research and practice to develop the data collection instruments. If the outcome being measured is the extent to which an enacted policy is affecting access to healthcare, the indicators could be utilization patterns and the number of registered clients, and measurements of these indicators should be made before and after the policy enactment and implementation. And determining such outcomes as change in access to healthcare requires the use of experimental or quasi-experimental evaluation research designs. And to determine outcomes and test the efficacy of an intervention, a rigorous research design using a control or comparison group may be required and to produce defensible conclusions. In answering questions related to causation and testing the underlying assumption that the initiative actually caused the outcome, the beneficiaries of the program are compared with themselves before and after the program or to a similar sample of people who did not participate in the initiative. Assessing outcomes may include assessing knowledge, attitudes, behaviors, frequency, and the existence or non-existence of an indicator. Or it may involve using biological or chemical markers in the participants or the environment to determine, for example, whether a test result changes from negative to positive, whether blood pressure rises or falls, or whether hemoglobin A1C levels have changed. And determining whether the initiative made a difference requires the use of experimental or quasi-experimental evaluation designs. In the experimental research design, groups are created by randomly assigning individuals to the intervention or the control group. However, in public health, quasi-experimental research and designs are considered more appropriate than experimental designs for assessing the impact of initiatives on population samples and populations at large. Quasi-experimental research designs use non-randomly assigned groups for comparison. And many evaluations rely on less rigorous designs that have neither a baseline nor a comparison or control group. And these are often called observational or non-experimental designs. And these evaluations are less time consuming, require fewer resources, and require less expertise than the more rigorous designs. But without a baseline, a comparison group, or a control group, little can be said about the effectiveness of the intervention. In the simplest designs, the intervention is tested in a single after intervention only assessment with one data point. An improved design to assess the effects of the initiative is comparing the population sample before and after the initiative in a single sample pre-post-test design. In this lecture, we will give a brief overview of the commonly used designs for conducting less involved and less complicated evaluations. Detailed explanations of evaluation designs may be found in the textbooks. So we start with the single sample designs. Here, there is no comparison group, and measurements are taken only of the group that is exposed to or that experiences the initiative. And measurements may be taken either after the exposure in a post-only design or before and after in the improved pre-post design. The assessments may be conducted using either qualitative or quantitative measures. The pre-post intervention design allows a comparison of baseline data to post-intervention data with the assumption that only the initiative could have changed the data. If the pre-intervention measurement or data is significantly different from the post measurement and there were not likely to have been any other influences on the beneficiaries of the intervention, the initiative might have produced the change. So these are designs that you may be familiar with, and you have probably used them to evaluate workshops and trainings, but they are usually ineffective for assessing whether the intervention caused any significant outcomes, especially in uncontrolled environments. And the satisfaction gained from participating in an intervention would be more appropriately measured in a post-only design, while knowledge gained or the effect of a policy change is more appropriately measured in pre-post designs. In general, the design used to assess the outcome is dependent on the research question and the most appropriate approach to answer the question and the expertise and preferences of the evaluator and the evaluation team. So the other factor that determines whether a pre-post design can be used is the ability to collect the data before the intervention and after the intervention. And so let us look at a specific example. And the research question is, did the participants in the one-day workshop on policy advocacy improve their knowledge of strategies for improving children's utilization of dental care? Using the pre-post design, this question can be answered by conducting a survey before and after the policy workshop using a combination of quantitative and qualitative measures. And questions in the survey should be limited to information provided during the workshop in order to determine whether the changes in scores were a result of participating in the workshop and relate to the content provided in the workshop. The difference between the baseline data and the post-test data is the change that occurred in the knowledge levels of the participants. And so this is a very controlled environment, so it is relatively easy to tell that participants increased their learning between coming into the workshop and completing the workshop. However, imagine trying to use the pre-post design in a large community. It will be impossible to draw any meaningful conclusions in such an uncontrolled environment. But there are other ways to design a study and that increase confidence in the results. Another type of research design for evaluation is the time series design. This is a single group design with multiple measures, and it's an improvement over the single group design that we have described. A time series design takes the measurements over an extended period of time to determine whether intervention effects are sustained. Using a time series design may involve the use of historical or secondary data for some or all of the measurement points. A significant limitation of these simple designs is that they do little to address threats to internal validity, as we'll discuss later in this lecture. Another kind of design is the comparison group design. And adding a comparison group improves the single sample design. A comparison group is as similar as possible to the intervention group, but the comparison group does not receive the intervention. Measurements are taken of the individual, group, or community exposed to the intervention, and the comparison individual, group, or community at the same time. And these designs address many but not all of the threats to internal validity, as we shall describe soon. To give an example, let us assume that Mary's team is assessing a policy information workshop at the public health facility that has 60 staff members. Two groups of 20 receive the training. The first group can use the second group as its comparison group, with the second group receiving the intervention later. The third group of 20 who are not exposed to the contents of the workshop can serve as the comparison group for the second group. And the third group may attend the training after the first two workshops are completed, but because that group is not part of the research study, it does not need a comparison group and no data need to be collected. Providing the training to the third group is dependent on resources, and by doing so addresses the issue of fairness. And finally, we look at time series designs with a comparison group. And so a comparison group can be incorporated into a time series pre-post design. And as we have said, the groups must be similar. And note also that the comparison group does not receive the intervention. Cost benefits and cost effectiveness analysis of a public health initiative assess the efficiency of a program, and these can be part of the outcome evaluation. Such analysis complement outcome assessments and can be used only after the program's outcomes are attained. Cost benefit analysis requires recording all direct and indirect costs of inputs, as well as estimates of all tangible and intangible benefits of the initiative. Cost effectiveness analysis allows the selection of one intervention over another. All the costs and benefits are specified in monetary terms, although doing so can prove difficult. Imagine trying to give a value to the multiple tangible and intangible benefits of a childcare program. Data for assessing the efficiency of an initiative must be gathered from all units participating in the initiative. And these cost-related data can be gathered from organizational records and receipts from staff, volunteers, and other stakeholders. Administrative expenditures include salaries, incentives, and travel expenses of personnel, costs for office space, utilities, and office supplies, and costs of running the office, for example, photocopying expenses, and office maintenance costs, such as outlays for cleaning and repairs, insurance, and equipment. Direct costs associated with initiative implementation include participant stipends, um, transportation reimbursements, costs for childcare, and cost of supplies such as games, food, books, rent for space and venue, cost of amenities, and cost of equipment, cost associated with instituting a policy, and cost to the beneficiaries of the initiative and of participating in the intervention of adopting a policy. Unintended costs associated with an initiative implementation are the unexpected costs engendered by a new initiative or program and policy. So the benefits related data may be more difficult than the cost data to obtain. They include such items as the value of play areas for children, lives saved, improved health status, or quality of life. Benefits may also be the cost savings that accrue in the long term. Cost benefit and cost effectiveness analysis require skills that may not be available on the evaluation team. Accounting and economics experts may need to be invited to support this kind of evaluation. It's also important to look at internal validity, which is the extent to which an effect that is observed was caused by systematically planned intervention and does not occur in the absence of the intervention. In assessing the outcomes of an intervention in an experimental or quasi-experimental evaluation research design, we would like to conclude that the results that occurs in the intervention group does not appear in the control group or the comparison group. And we assume that the difference is real and is not due to random or systematic error. When we draw this conclusion correctly, we can claim that the intervention caused the outcomes we observed. However, when we draw this conclusion erroneously and conclude that the intervention had an impact on the intervention group and not on the control group, when in fact the intervention group and the control group did not differ, then we have a type 1 error. And when we draw the conclusion also erroneously that the intervention had no impact when in fact it did, and the results for the intervention group should have been different from the results for the control group, then we have a type 2 error. It is important to consider the multiple factors that may influence the evaluator's ability to conclude that the intervention resulted in the observed changes. The factors that prevent or limit an evaluator's confidence that the initiative caused the effects or the outcome are referred to as threats to internal validity. And we'll look at some of the most frequent threats to internal validity. And the first is attrition, which is a loss of participants in the intervention that is different from the loss that occurs in the initially similar control group, resulting in different kinds and different numbers of people in the post-test phase. Another consideration is history. Events that take place outside the intervention may affect the measurement of changes that are due to the program, and such events may result in an inflation of post-test scores. Another threat is instrumentation. Changes to the reliability and validity of measurement tools used to assess the effects of the program. Maturation too is another cause of another threat to validity. So changes in the study participants that are due to natural and physiological developments take place over time and are not necessarily caused by the program. So such natural changes may occur in children and in the elderly. Another threat is regression. And when study participants are selected on the basis of high or low baseline scores, the result of the testing will show they regress towards the population mean. Higher scorers will show lower scores in the post-test, and low scorers will show higher scores. Selection is next, and differences in intervention and comparison group occur when people self-select into the groups or when people drop out of the groups disproportionately. The result is that those who stay may be likely to succeed with or without the program. Statistical conclusion can also be a threat to validity, and when the sample size is too small to show the effect of the measurement, the effect or the measurement instruments are unstable and unlikely to measure true changes because of high standard error estimates. Other statistical conclusions and threats include violated assumptions of statistical tests and the likelihood of concluding that there is covariance when there is not, as happens in type 1 errors. There's also a phenomenon called phishing, which occurs when multiple comparisons are run during a statistical analysis without realizing that the results may be significantly different just by chance. Also important is testing. as a threat to validity. So changes that occur to the study participants when a test that is given before the intervention may affect the results when the test is given again after the intervention and in pre-post design and pre-post designs. So the threat may be due to participants' familiarity with the test items and their error responses if they remember them. So the evaluation designs that contain single sample pre-post measurements and those utilizing comparison groups address the threats to validity to a lesser or greater extent. And the single group post-only design is the least likely to minimize threats to internal validity, while experimental evaluation designs using randomly assigned controls and intervention groups and communities are the most likely to minimize these threats, and therefore they allow the most certainty that the intervention caused the changes that occurred in the beneficiaries. In a quasi experimental design, many of the threats to validity are addressed also, but they may require additional measures to ensure the same level of confidence that randomly assigned control groups provide. So measures include using matching and randomly selected groups, not individuals, in a model that promises a delayed intervention. Additional threats to internal validity take place that are not minimized by using randomized samples. And these include diffusion or imitation, which occurs when the information intended for the treatment group or the intervention group is obtained by the control group. And the difference between the intervention group and the control group is thereby narrowed. And this is also called contamination. Another threat could be compensatory equalization, which occurs when the control group is provided with or obtains an alternative intervention that results in narrowing the differences between the intervention group and the control group. There's also compensatory rivalry, which occurs when the control group works hard to rival the intervention group to improve the outcomes, and such rivalry minimizes the differences between the two groups. It's also important to consider external validity, which is the extent to which an observed effect or outcome can be generalized to other times, settings, and populations. The larger and more heterogeneous the sample that participates in an intervention that is found to be internally valid, the more likely it is that the outcome is generalizable. And one of the most important threats to external validity is selection bias, which may be inherent in the selection of the participants or which may occur in the loss of participants resulting from attrition. And the effect is, in either case, is a more homogeneous and biased sample than would otherwise exist. So in summary, evaluation questions are best selected through a participatory process involving the evaluators and the stakeholders. And utilizing a 2x2 table allows the group to arrive at a set of appropriate evaluation questions. And process evaluation questions ask whether the program was implemented as planned, and they assess the initiative at the level of resources or inputs, activities, and outputs, including the administrative functions of the program. In assessing efficiency, the perspectives from which the cost and benefits may be assessed are participants, program sponsors, and overall cost to society. The societal costs being the most difficult to value monetarily. In determining outcomes and the efficacy of an intervention, a rigorous research design using a control or comparison group may be required to produce defensible conclusions. Internal validity describes a causal relationship. External validity describes the generalizability of the intervention across time, people, and places. And the type 1 error occurs when it is erroneously assumed that the intervention caused the outcome, while the type 2 error occurs when it is erroneously concluded that the intervention did not have an effect on the outcome. Thanks for listening. See you in the next lecture.